I want to talk to you today about something that some older adults notice, often while lying down or resting a hand on the belly, and that can feel alarming but is usually harmless, while occasionally worth understanding for the sake of one important condition: a pulsing, throbbing, or beating sensation in the abdomen, as if you can feel your heartbeat in your belly, and what this can mean. Because feeling a pulse in your abdomen can be unsettling, and it's natural to wonder what's going on. Yet this sensation is most often simply the normal pulsation of the body's main artery, which is usually nothing to worry about. While occasionally, in certain people, it can relate to a condition of that artery worth being aware of, called an abdominal aortic aneurysm. So understanding this helps you respond wisely, neither over-worrying nor missing the rare important situation. So today I want to explain why you can feel a pulse in your abdomen, why it's usually normal and harmless, the one condition worth being aware of, who's more at risk, the crucial emergency to know, and what to do, in partnership with your doctor and emergency services. And I'll keep this calm and balanced because the pulsing feeling is usually harmless normal pulsation, while awareness of the one important condition, held in proportion, is worthwhile, in partnership with your doctor. This is about a usually harmless sensation with one important awareness point. Let me start with why you can feel a pulse in your abdomen, because understanding it is reassuring. The reason you can sometimes feel a pulse, throb, or beat in your abdomen is usually simple and normal. The body's main artery, the aorta, runs down through the chest and abdomen, carrying blood from the heart, and it naturally pulses with each heartbeat. In many people, especially when lying down, resting or pressing on the belly, this normal pulsation of the aorta can be felt through the abdomen, particularly in those who are slim, where there's less tissue between the skin and the artery. So feeling your abdominal pulse is most often just the normal beating of your aorta, which everyone has, made noticeable by position, slimness, or simply paying attention, and is usually completely harmless. So you can feel a pulse in your abdomen because the body's main artery, the aorta, naturally pulses through the abdomen, often felt when lying down, resting, or in slim people, usually as a completely normal, harmless sensation. So understanding that the pulsing is usually normal, aortic pulsation is reassuring. So an abdominal pulse is usually normal, so feeling your abdominal pulse is usually harmless. Let me reassure you about how common and benign this usually is, because it matters. Let me reassure you clearly, feeling a pulse or throb in your abdomen is common and usually harmless, simply the normal pulsation of your aorta, especially noticeable when lying down, after eating, in slim people, or when you're aware of it. It does not by itself mean you have a problem with the artery. Many people notice their abdominal pulse at times and are perfectly healthy, so please don't be alarmed simply by feeling your abdominal pulse. The large majority of the time, it's the normal, harmless pulsation everyone has. The awareness point I'll discuss is about one specific condition and certain risk factors and features, not the ordinary felt pulse being a worry. So feeling your abdominal pulse is common and usually harmless normal pulsation, not by itself a sign of a problem, while the awareness point concerns one specific condition and certain features. So the felt pulse is usually benign, so don't be alarmed by an ordinary abdominal pulse. Let me explain the one condition worth being aware of, because it's the important awareness point, held in proportion. The one condition worth being aware of, held firmly in proportion, is an abdominal aortic aneurysm, which is a bulging or widening of the aorta in the abdomen, where the wall of the artery weakens and balloons out. Most are small, cause no symptoms, and are often found incidentally, and many simply need monitoring. A large or growing aneurysm matters because rarely it can be at risk of bursting, which is a serious emergency, so they're worth identifying and monitoring. Now, importantly, feeling your abdominal pulse does not mean you have an aneurysm, since the felt pulse is usually normal, and you cannot diagnose an aneurysm yourself by feel. The reason to be aware of aneurysms isn't to worry about every felt pulse, but to know the condition exists, who's more at risk, and why screening and awareness matter. So an abdominal aortic aneurysm, a bulging of the aorta, is the one condition worth being aware of. But feeling your abdominal pulse doesn't mean you have one, and you can't diagnose it yourself, so the point is awareness, not worry. So an abdominal aortic aneurysm is the awareness point, held in proportion not a reason to fear every pulse. So the one condition to be aware of is an aortic aneurysm, in proportion. So aneurysm awareness, not pulse worry, is the point. Let me tell you who's more at risk, because that's where awareness genuinely helps. Awareness of abdominal aortic aneurysms genuinely helps because certain people are more at risk and benefit from screening. Risk factors include being older, particularly men over 65, a history of smoking, which is a major risk factor, high blood pressure, a family history of aneurysms, and other cardiovascular disease. Because of this, in some places, screening is offered to those at higher risk, for example, a one-time ultrasound scan for older men, which is a simple, painless way to check the aorta. So the genuinely useful action isn't to worry about your felt pulse, but if you're in a higher risk group, especially an older man or a smoker or former smoker, to ask your doctor about whether aneurysm screening is appropriate for you and to attend any screening you're offered. So those more at risk of an aneurysm include older men, smokers or former smokers, and those with high blood pressure or a family history who benefit from screening. So the useful action is asking your doctor about screening if you're higher risk, not worrying about the felt pulse. So screening, not pulse worry, is the useful action for higher risk people. So know your risk and ask about screening. Let me be clear about the crucial emergency, because it's the one urgent thing to know. Crucially, while most aneurysms cause no symptoms and the felt pulse is usually normal, there is one important emergency to know about. A burst or bursting abdominal aortic aneurysm is a dire emergency, and its warning can include sudden, severe pain in the abdomen, back or side, often described as severe and persistent, a pulsating sensation or mass in the abdomen with such pain, dizziness, fainting, or collapse, and feeling very unwell, pale or clammy. So sudden, severe abdominal, back or side pain, especially with a pulsating sensation, dizziness or collapse, particularly in someone at risk of an aneurysm, is a medical emergency needing immediate care. So treat sudden, severe, unexplained abdominal, back or side pain, especially with faintness or collapse, as a medical emergency and call emergency services immediately. This is rare, but it's the one urgent thing to know. So a possible bursting aneurysm, sudden severe abdominal, back or side pain with faintness or collapse, is a medical emergency warranting calling emergency services immediately. So sudden severe abdominal or back pain with collapse is an emergency. So know the bursting aneurysm emergency. Let me be clear about what to do, because it keeps everything in proportion. So here's what to do in proportion. For simply feeling your abdominal pulse without pain or other symptoms, especially if you're slim or notice it lying down, this is usually normal, harmless pulsation, and no alarm is needed, though you can mention it to your doctor for reassurance if it concerns you. If you're in a higher risk group for an aneurysm, an older man, a smoker or former smoker, or someone with high blood pressure or a family history, ask your doctor about whether aneurysm screening is appropriate and attend any screening offered. See your doctor, non-urgently, if you feel a distinct pulsating lump or mass in your abdomen, or have persistent unexplained abdominal or back discomfort, for assessment. And crucially, call emergency services immediately for sudden, severe abdominal, back or side pain, especially with faintness, dizziness or collapse. So don't worry about an ordinary felt pulse. Ask about screening if you're higher risk. See your doctor for a distinct pulsating mass or persistent discomfort, and treat sudden severe abdominal or back pain with collapse as an emergency. So keep it in proportion. Reassurance, screening if higher risk, and knowing the emergency. So respond in proportion, with screening and emergency awareness. Let me reinforce the prevention and overall vascular health angle, because it's empowering. Let me add an empowering point. The same things that protect your heart and circulation also help protect against aneurysms and their growth. So looking after your cardiovascular health is protective here too. Most importantly, not smoking, since smoking is a major risk factor for aneurysms. So stopping smoking genuinely lowers your risk. Also managing blood pressure, keeping active, eating well, and managing cholesterol, as I've discussed for the heart, all support healthy arteries. So beyond screening and awareness, looking after your overall cardiovascular health, above all not smoking, helps protect your aorta along with your heart. So the same cardiovascular care that protects your heart especially not smoking and managing blood pressure. Helps protect your aorta against aneurysms too. So overall vascular care, especially not smoking, is protective. So caring for your heart helps protect your aorta. Let me paint you a quick picture of how this helps. Picture a slim man in his 70s who, lying in bed, notices a distinct pulsing in his abdomen and becomes frightened he has something seriously wrong. Understanding that feeling the abdominal pulse is usually just the normal pulsation of the aorta, especially in slim people lying down, and doesn't itself mean an aneurysm, he's reassured, while sensibly noting that, as an older man and former smoker, he's in a group for whom aneurysm screening is worthwhile. So he asks his doctor, who arranges a simple ultrasound that checks his aorta, giving him either reassurance or, if anything is found, appropriate monitoring, all without panic. He also knows that sudden severe abdominal or back pain with faintness would be an emergency. The same man, but understanding the felt pulse in proportion and acting sensibly on screening, got reassurance and appropriate care without fear. That contrast is exactly why understanding this sensation, in proportion, matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that feeling a pulse in the abdomen is usually just the normal, harmless pulsation of the aorta, especially in slim people or when lying down, and doesn't itself mean a problem. While the one awareness point is the abdominal aortic aneurysm, for which older men, smokers or former smokers, and those with high blood pressure or a family history are more at risk and benefit from screening. You can help by reassuring a loved one about the ordinary felt pulse, while encouraging them, if higher risk, to ask their doctor about aneurysm screening and attend any offered, and supporting not smoking and cardiovascular care. Crucially, treat sudden, severe abdominal, back or side pain, especially with faintness, dizziness or collapse, as a medical emergency and call emergency services immediately, helping a loved one keep this in proportion with reassurance, screening if appropriate, and emergency awareness supports their safety without fear. So let me draw this all together. A pulsing or throbbing sensation in the abdomen, feeling your heartbeat in your belly, is most often simply the normal pulsation of the aorta, the body's main artery, especially noticeable when lying down, after eating, in slim people, or when you pay attention, and is usually completely harmless, not by itself a sign of a problem. The one condition worth being aware of, in proportion, is an abdominal aortic aneurysm, a bulging of the aorta. But feeling your pulse doesn't mean you have one and you can't diagnose it yourself. So the point is, awareness, not worry. Those more at risk, older men, smokers or former smokers, and those with high blood pressure or a family history, benefit from screening. So the useful action is asking your doctor about screening if you're higher risk. Crucially, sudden, severe abdominal, back or side pain, especially with faintness or collapse, can signal a bursting aneurysm and is a medical emergency. So don't worry about an ordinary felt pulse. Ask about screening if higher risk. See your doctor for a distinct pulsating mass or persistent discomfort. Treat sudden severe abdominal or back pain with collapse as an emergency. And look after your cardiovascular health. Above all, not smoking. So here's what I'll leave you with, straight and clear. First, understand that feeling a pulse or throb in your abdomen is most often simply the normal pulsation of your aorta, the body's main artery, especially noticeable lying down, after eating, in slim people, or when you pay attention and is usually completely harmless. Second, know that this felt pulse does not by itself mean you have a problem, and you cannot diagnose anything by feel, so an ordinary abdominal pulse, without pain or other symptoms, is usually nothing to worry about. Third, be aware in proportion of the one condition worth knowing, an abdominal aortic aneurysm, a bulging of the aorta, most of which are small and simply monitored, the point being awareness rather than worry. Fourth, know who's more at risk and benefits from screening, older men, smokers or former smokers, and those with high blood pressure or a family history of aneurysms. So, if you're in a higher risk group, ask your doctor about whether aneurysm screening, often a simple ultrasound, is appropriate for you, and attend any screening offered, while seeing your doctor for a distinct pulsating lump or persistent, unexplained abdominal or back discomfort. And fifth, crucially, treat sudden, severe abdominal, back or side pain, especially with faintness, dizziness, or collapse as a medical emergency and call emergency services immediately, while protecting your aorta, along with your heart through cardiovascular care. Above all, not smoking. A pulsing feeling in the abdomen is usually harmless normal pulsation, with the abdominal aortic aneurysm as the one awareness point best handled through knowing your risk and screening, rather than worrying about the felt pulse. So keeping this in proportion lets you respond wisely with reassurance, appropriate screening, and emergency awareness, which is well worth doing. So take care of yourself. Don't worry about an ordinary abdominal pulse. Ask about screening if you're higher risk, look after your cardiovascular health, don't smoke, and know the emergency. And because while the felt pulse is usually normal, abdominal aortic aneurysms are worth screening for in those at risk, and a bursting one is an emergency, please treat being in a higher risk group as your reason to ask your own physician about aneurysm screening. A distinct pulsating mass or persistent abdominal or back discomfort as your reason to see your doctor, and sudden severe abdominal, back or side pain with faintness or collapse as your reason to call emergency services immediately.